Welcome back to the Deep Dive, where we take complex source materials and really give you the inside track on what you need to know. Today, we're going into the, I'd say, super specialized world of endoscopic tools. And our main source for this is a fantastic video from Dr. G.S. Raju's YouTube channel. It's called HCC 1472 Lesson 12, a Foreign Body Retrieval Rat Tooth Forceps.
That's right. So for this deep dive, we're really zoning in on one very specific instrument, the foreign body retrieval forceps. We're going to get into how it works, but I think more importantly, why its design is so critical when a doctor is trying to get something out of you that just shouldn't be there.
And the name of this tool is pretty unforgettable. It's called the rat tooth forceps,
Yeah.
which, it conjures this image that seems, well, a bit intense for a hospital setting.
Yeah.
But let's start with the basics. The handle and everything.
Right.
It's pretty standard, right? How does an endoscopist actually use it?
It's fascinating because the operation itself is designed to be really simple and intuitive, just like a lot of other GI instruments. So if you're holding it, you put your thumb into the thumb ring. Okay.
And then your forefinger and middle finger, they go right onto the slider mechanism. And that setup is really important because it allows for these tiny micro adjustments while, the other hand is probably busy managing the scope itself.
Right. So let's dig into that control aspect a little more.
It's very direct.
Right.
A simple closing of your grip, just making a fist, basically, that closes the jaws at the end of the forceps.
And to open them.
You just do the opposite. You open your grip and push that slider away from your thumb, and the jaws open up. It's a system that turns, these larger hand movements into incredibly precise actions deep inside the body.
And that precision has to be non-negotiable when you're grabbing something sharp or dangerous.
Okay, that makes sense. But here's the part that I found really crucial, and it's a huge warning in the source material. It says if you're asked for a foreign body forceps, you should never hand over a standard biopsy forceps. But wait a second. If the handles look and feel almost identical, isn't that a huge risk in a high-pressure situation? Like, how does a nurse not grab the wrong one by mistake?
That's a great question, and it really gets to the heart of procedural safety. The handles are similar for ergonomic reasons, for familiarity, but the working ends, the tips, are fundamentally different. The source material makes it really clear that this is all about training. The team has to know the difference instantly. No hesitation.
Okay, so let's talk about why. Why is it such a critical mistake? What's the core design difference?
It all comes down to their intended job. A standard biopsy forceps has these little cups at the end, and they are designed for one thing: cutting tissue.
To take a sample.
Exactly. They're built to excise, to cut.
So if you try to use those little cutting cups to grab, say, a coin, something smooth and hard, what happens?
It's almost guaranteed to fail. You can imagine trying to pick up a wet marble with a tiny pair of scissors. It just won't work.
It would just slip right off.
It'll either slip right off, or even worse, it might actually try to cut into the foreign body. And all you're doing is wasting valuable time and making the procedure much harder. You need gripping power, not cutting power.
Okay, so you need a tool that's built for, let's call it aggressive, non-slip gripping.
Precisely.
And that's where the rat tooth forceps gets its name.
Yeah.
From that very effective and kind of visceral design.
Yes. Instead of those smooth cutting cups, the rat tooth forceps has, well, a rat teeth type design. Think of them like tiny medical grade industrial grippers. They're built to bite into or just securely clamp onto something that isn't tissue and to hold on under tension. That's the difference between success and a very high stakes failure.
It's amazing that such a small change at the very tip completely redefines the tool's purpose.
Yeah.
And what the source video shows is that even within this category, there's a lot of variation. It's not just one tool, is it?
No, not at all. It's really a family of tools. The design gets customized based on what kind of object you're expecting to find. The source material points out 4 different combinations based on 2 key variables.
Okay, what's the first variable?
The first one is jaw length. You can get short-jawed or long-jawed forceps.
And what's the thinking there?
A long-jawed version gives you a bit more reach, maybe for larger or oddly shaped objects. The short-jawed version, though, it gives you a much more concentrated, powerful bite. Perfect for smaller things.
That makes sense. A longer jaw for a bigger object, but for something small and dense, you want all that force in one tiny spot.
Exactly. And then the second variable is all about the texture of that gripping surface.
Okay.
It's the presence or absence of serrations in the jaw. And this might be the most important detail when you're dealing with something really slick.
So you can have a long jaw with serrations or a short jaw without them. What problem are the serrations solving?
Well, think about the physics of it. Serrations add friction. They add mechanical purchase. If you're trying to grab a smooth, wet coin or a piece of slick plastic,
Right.
those tiny ridges, the serrations, they dig in and stop it from slipping. If you have a coin lying flat against the wall of the stomach, you absolutely need those serrations to get a purchase on it before you can pull it out.
So that brings us right to the so what factor. We've talked about the engineering for maximum grip. Let's talk about what these are actually used for.
Yeah.
What are the common, and I imagine sometimes terrifying things these tools pull out?
They're definitely used for high-stakes retrievals. The source video highlights three main categories where this tool is just essential.
Okay, what's first?
First, coins. Probably the most common ingested foreign body, especially with kids. They're round, they're smooth, and they're incredibly hard to grab if they're lying flat.
That's a classic problem, isn't it? How do you grab a perfectly featureless, round object?
Right. And the rat tooth forceps, specifically the serrated kind, is one of the best tools for that job.
Hmm.
Second, safety pins.
Oh, wow. That's a whole other level of danger.
It is, because now you have a dual problem. It's smooth metal, so you need the grip, but it's also sharp and often partially open. That is a situation where you need a zero slippage grab. A slip could mean a perforation, which is a catastrophe.
You have to lock onto that pin, probably on the closed side, and just keep it perfectly oriented all the way out. Every single movement matters.
Every millimeter. And the third major use is a bit different. It's more of a scheduled procedural thing, and that's retrieving plastic stents.
This often happens after a procedure called an ERCP, right?
That's right. Endoscopic retrograde cholangiopancreatography.
So just to give everyone some context, why are these stents there in the first place?
So these stents, plastic biliary or pancreatic stents, they're put in to open up blocked ducts, maybe from gallstones or swelling. They're temporary. They stay in for a few weeks or months to let things drain and heal.
And when the job is done, they have to come out.
They have to come out. And since they're made of smooth plastic and they have these little flanges to hold them in place, the rat tooth forceps is perfect for grabbing the end of that stent and just gently pulling it out.
Okay, but for something long and thin like a stent, is the rat tooth forceps always the go-to? Or are there other options?
That's a great point, and it shows how the endoscopist has to make these real-time decisions. The rat tooth is excellent for getting a secure grip on the end of that stent, but they might also call for a snare device.
Which is like a little lasso.
Exactly, a tiny adjustable lasso. It can be useful if the stent is coming out of the duct at a weird angle where it's hard to grab head-on. But for just pure brute force gripping power on that plastic, the rat tooth forceps is often the first choice because the lock is just so secure.
That really drives the point home. It has this superior specialized grip strength for these hard, non-tissue objects. It really is a specialist tool. So to recap the key takeaways from this deep dive into Dr. Raju's material, you now understand that critical difference between a tool for cutting, the biopsy forceps, and a tool for gripping, the rat tooth forceps. Right.
You get the basic mechanics, the thumb ring and the slider, and you know that these are the tools you need for everything from slick coins and dangerous safety pins to planned removals of medical stents. And the big idea here is just how important specialized engineering is. A really subtle design change, those rat teeth and the serrations, it completely alters what the device can do. It turns a basic tool into a high-stakes retrieval specialist. Which leaves us with a final thought for you to consider. Given how absolutely critical it is to have a reliable, powerful grip on these objects lodged inside the body, what kind of engineering challenges or safety redundancies do medical device designers have to solve to make sure a tool like this never fails during a retrieval? Thank you for joining us as we went deep into the world of foreign body retrieval. We'll catch you next time.